When experiencing lower back pain, we usually assume the spine is damaged, but this amber tension points to severe compression in the hip flexors. This compression is a direct result of how we spend our days. Sitting for hours holds the primary muscles running down the front of your body in a tightly locked, permanently shortened position. This schematic isolates the psoas. It acts as a biological bridge, anchoring to your lower lumbar vertebrae and tying into your femur. When pulled tight, the shortened psoas yanks the spine forward, tilting the pelvis and grinding the lower vertebrae together. Massaging or treating the lower back only addresses the symptom of this mechanical chain reaction. To achieve permanent relief, you have to release the tension pulling from the front of the hips. This is what that tension looks like on a microscopic level. Chronic restriction leaves these muscle fibers tightly bundled and starved for circulation. Healing them requires a biological transition, coaxing them to loosen, lengthen, and restore normal blood flow. To trigger that transition, you need 3 things: a flat surface, a wall, and a strict commitment of 10 minutes a day. Step 1 is cat-cow. Before we can isolate the hips, we need to restore basic spinal mobility and get the pelvis moving fluidly again. In this profile animation, the mechanics of cat-cow are highly specific. By alternating between anterior and posterior pelvic tilts, you actively decompress the lower spine. The vector lines show the space between your lumbar vertebrae expanding and contracting with each movement. Step 2 is child's pose. By sinking your hips back toward your heels, you apply a gentle preliminary elongation to the entire pelvic floor, which has been deeply compressed by sitting. These first 2 movements are strictly preparatory. They prime your tissues and signal your nervous system that it is safe to begin the deeper release. Now we move to the core of the protocol. Step 3 is pigeon pose, which serves as the primary mechanical lever for directly targeting and stretching the psoas. This top-down grid illustrates the most common point of failure. If your body weight rolls entirely onto one hip, you neutralize the stretch. The grid shows exactly why your hips must remain perfectly squared to the floor. Notice how correcting that alignment forces the extended leg psoas to bear the full weight of the stretch. As the hips square up, the muscle shifts from a compressed, tightly wound state into full elongation. Step 4 is the supine twist. While pigeon isolates the psoas, this twisting motion acts like a sponge, wringing out the residual tension stored in the surrounding fascia and oblique muscles. By isolating the target muscle and then addressing the connective tissue around it, you break the physical cycle of chronic tension. Step 5 shifts the goal. We move into legs up wall, transitioning from active muscular stretching to passive nervous system regulation. Elevating your legs against a vertical surface reverses gravitational pull. This assists in the return of blood and metabolic waste from the lower extremities, allowing the pelvic floor to release its protective bracing. This systemic view tracks the transition of your nervous system. As these nerve pathways shift from a high-alert sympathetic state to a calm parasympathetic state, the brain stops sending the signal to produce high levels of stress hormones like cortisol. Mechanical stretching is temporary if your brain still thinks the muscle needs to brace for impact. You have to retrain the central nervous system to accept this new, elongated resting length. This split-screen comparison shows the exact anatomical transformation we are after. On the left, the shortened psoas pulls the pelvis into an anterior tilt. On the right, after releasing that tension, the spine returns to a straight, neutral alignment. This visual lays out your complete protocol: cat-cow, child's pose, pigeon, supine twist, and legs up wall. To be effective, these 5 steps must be executed in this precise anatomical order. If you treat this routine as a one-time intensive fix, it will fail. The moment you sit back down at a desk, your psoas will inevitably begin reverting to its shortened state. The objective is to interrupt the adaptive shortening that occurs during 8 hours of sitting. By providing a consistent 10-minute daily signal to the tissues, you counter the process that otherwise turns temporary muscle tension into a permanent structural misalignment. Try this sequence today and listen to your body's immediate physical response. You will feel the tension release from your lower back as the front of your hips open up. Resolving back pain requires realizing that it is a daily mechanical challenge. By addressing the root cause every day, you turn a medical intervention into a lifelong preventive hygiene practice.